In this video, we'll be discussing the top 8 warning signs you need to know about. Stay tuned to learn how to detect colon cancer early and improve your chances of successful treatment. Welcome to our video on the early signs and symptoms of colon cancer. Colon cancer is one of the most common types of cancer, and it is important to catch it early for the best chances of successful treatment. Make sure to watch the video until the end to learn all about them. If you find this information helpful, please don't forget to like, comment, and subscribe to our channel for more informative videos like this. Your support means a lot to us and helps us to keep creating content that you'll love. It is important to understand the early signs and symptoms of colon cancer, as early detection and treatment can significantly improve prognosis. Here are 8 signs and symptoms of colon cancer. 1. Changes in bowel movements. Changes in bowel movements can be an early sign of colon cancer. Other signs to look out for include blood in your stool, abdominal pain, unexplained weight loss, and fatigue. It is important to note that these symptoms may be caused by other conditions, but it is still important to discuss any changes in bowel movements with your doctor to rule out the possibility of colon cancer. 2. Blood in the stool. One of the early signs and symptoms of colon cancer is the presence of blood in the stool. Blood in the stool can be an indication that there is bleeding in the colon, which can be a result of a cancerous growth. It is important to note that not all cases of blood in the stool are due to colon cancer, but it is still crucial to see a doctor for proper evaluation and diagnosis. In some cases, the blood in the stool may not be visible to the naked eye and can only be detected through a fecal occult blood test. This test can help detect small amounts of blood in the stool that may not be visible. If you experience any changes in bowel movements, including the presence of blood in the stool, it is important to see a gastroenterologist for proper evaluation and diagnosis. 3. Abdominal pain and cramping. Abdominal pain and cramping can be a possible early sign of colon cancer. This can occur due to the tumor growth blocking or narrowing the colon, leading to pain and discomfort. The pain may be persistent and worsen over time, accompanied by other symptoms such as bloating and changes in bowel movements. It is essential to note that these symptoms may also be due to other health conditions, so it is crucial to consult a doctor if they persist or worsen. 4. Unexplained weight loss. Unexplained weight loss is another possible early sign of colon cancer. The tumor in the colon can cause changes in metabolism and digestion, leading to weight loss. Additionally, the cancer cells use up energy and nutrients, further contributing to weight loss. Research shows that weight loss of more than 5 of body weight without an obvious cause can be a red flag for colon cancer. However, weight loss can also be a symptom of many other health conditions, so it is important to consult a doctor for proper diagnosis and treatment. If you are experiencing unexplained weight loss along with other symptoms like changes in bowel movements or blood in stool, it is important to see a gastroenterologist or oncologist for further evaluation and testing. 5. Fatigue and weakness. Fatigue and weakness can be an early sign of colon cancer. When cancerous cells grow in the colon, they can lead to anemia, which results in a shortage of red blood cells in the body. This can cause weakness, fatigue, and shortness of breath as the body is not getting enough oxygen. It is important to note that there are other possible causes of fatigue and weakness, but if they are persistent and unexplained, it is important to consult with a healthcare professional to rule out any underlying health conditions such as colon cancer. 6. Iron deficiency anemia. Iron deficiency anemia can be an early warning sign of colon cancer, especially in older adults. The colon absorbs nutrients, including iron, from the food we eat. When colon cancer blocks the colon, it can prevent the absorption of iron, leading to anemia. Iron deficiency anemia occurs when there is not enough iron in the body to produce hemoglobin, the protein in red blood cells that carries oxygen throughout the body. If you have iron deficiency anemia, your gastroenterologist may recommend a colonoscopy to investigate the underlying cause. While iron deficiency anemia is not always a sign of colon cancer, it is important to rule out any underlying issues, especially in older adults or those with a family history of colon cancer. In addition to a colonoscopy, your gastroenterologist may also recommend additional blood tests or imaging studies to evaluate your overall health and assess any potential risk factors for colon cancer. It is important to address any symptoms of iron deficiency anemia as soon as possible to prevent potential complications and ensure optimal health. 7. Feeling like your bowel doesn't completely empty. Feeling like your bowel doesn't completely empty can be an early sign of colon cancer. This is because a tumor in the colon can cause a blockage, making it difficult for stool to pass through. As a result, you may feel like your bowel doesn't completely empty after a bowel movement. It is important to note that other conditions, such as hemorrhoids or irritable bowel syndrome (IBS), can also cause this symptom. However, if you experience this symptom along with other early signs and symptoms of colon cancer, such as abdominal pain and cramping, blood in the stool, unexplained weight loss, and fatigue, it is important to talk to your doctor right away. 8. Rectal bleeding. Rectal bleeding is a common symptom of colon cancer, especially in the later stages of the disease. However, it can also be an early sign, particularly if it is accompanied by other symptoms such as changes in bowel habits or abdominal pain. The bleeding may be bright red or dark and tarry, and may occur during or after bowel movements. It is important to see a doctor if you experience rectal bleeding, as it may be a sign of a serious medical condition such as colon cancer. My tip for keeping your colon healthy and avoiding colon cancer is to maintain a healthy lifestyle. This includes eating a diet rich in fiber, fruits, and vegetables, drinking plenty of water, and engaging in regular physical activity, such as running or brisk walking. In addition, getting regular screenings for colon cancer can help detect any potential issues early on, when they are more treatable. The American Cancer Society recommends getting regular colon cancer screenings starting at age 45 for most people, but those with a family history of colon cancer or other risk factors may need to start screening earlier. By adopting healthy lifestyle habits and getting regular screenings, you can help keep your colon healthy and lower your risk of developing colon cancer. In conclusion, it's important to be aware of the early signs and symptoms of colon cancer to catch it in its early stages. If you're experiencing any of these symptoms, it's important to see a doctor for further evaluation.